During a surgery, because of the increased depth of anesthesia, patient's airway can be functionally maintained, and the blood oxygen level is decreased. Then it will cause respiratory distress easily.
Heroic Faith Air Mode provides continuous monitoring of patient breathing and assists anesthesiologists to make a quick diagnosis, then greatly reduce the risk during anesthesia. Heroic Faith Air Mode provides continuous monitoring of patient breathing. Help the patient to lie on his or her back and place the monitor nearby. Place the adhesive patches to patient's neck. The auscultation can be heard through headphone and also integrate with AI-powered respiratory sound continuous monitoring system. The AI-powered respiratory sound continuous monitoring system can display breathing sounds in real time, visualized auscultation, accurate respiratory rate, ambient noise cancellation, and deep learning assisted.
My name is Stanley Liu. I'm an assistant professor of otolaryngology at the Stanford University School of Medicine. I'm also a former biodesign faculty fellow. And it is with tremendous pride that I get to share with you my thoughts and my work in collaboration with the Heroic Faith team in Taiwan. I got connected with this team really during the beginning of the pandemic, and it was tremendous and couldn't be more timely when they put together a technology that allowed continuous remote monitoring of lung sounds while at distance to monitor patients who are deteriorating. Now, this was huge at the beginning of the pandemic. PPE was in great short supply and resources were completely strained. And this absolutely fulfilled an unmet need. Beyond the pandemic, any lung disease that requires remote continuous monitoring has a potential solution here. We're talking about asthma or COPD exacerbations. We better know whom the patients are, who needs more urgent care.
这个预讯的这个 Air Mode 的所谓的正音的这种电子的听诊器，它可以把我们录到的声音的波长，还有它的形状，全部都显现出来。所以对我们的临床的诊断，就说不是只有说听到，那对我们的诊断来讲，帮助就变得非常的大。
Yes, I'm Jane Siu, and I'm currently a professor at National Taiwan University, and I'm also directing a research center on Internet of Things, as well as AI and HCI. Okay, so artificial intelligence has developed for many years, and but I think the recent 15 years of advancements is in particular on the issue of data-driven model building. So the idea is that with the increasing amount of data, we are able to use machine learning techniques, in particular things like deep learning, to build very powerful model. Of course, there are a lot of useful applications in the field of medicals. So all kinds of sensors can generate continuous streams of data, and that can be analyzed. This is a very interesting collaboration because as many people know, to diagnose sleep apnea, oftentimes you need to go through the sleep study and maybe go through a more invasive procedure called DISE. So the idea is that instead of relying on the time-consuming and possibly expensive procedure, we want to be able to build a model to understand snoring sounds. And so we use annotated snoring sounds to build machine learning models to be able to identify the particular pattern of obstruction so that that can be used to guide the treatment for sleep apnea. Okay, so the Heroic Faith device can be used to record the snoring sound of the patient, and we can use the the model to analyze the snoring sound so that we can identify one out of a few possible major site of obstruction. And so at this point, we are able to apply a number of different machine learning techniques. It's interesting to see heroic face device allow such a recording to happen. So with this kind of device and the associated software for the analysis, I think there are a lot of possibilities, and in particular, with this type of model, we will be able to make earlier analysis without the intrusive procedure, so that will give the doctor some guidance in terms of deciding the proper treatment. So I would think it will definitely help the delivery of good treatment for the patients, and also we will be able to achieve better accuracy.
Most importantly, it is an anesthesiologist's responsibility to make sure patients' safety and assist surgeons to smoothly perform the surgery without extra concerns.